Hello. Just want to make sure that I know how to operate this. Okay. All right. So my name is Anna Rappold. I'm a statistician working at EPA. I am not an expert on wildfires. We've just been publishing. We've been looking at health effects of wildfire smoke exposure, and that kind of keeps on leading us to new and new avenues. And where we are right now is, and what I'm going to talk about is this citizen science approach to addressing part of the large picture. And the project is called Smoke Sense. So what motivated Smoke Sense is, this observation that about what we know about how to protect our health from air pollution, and the actual observed outcomes that we are reporting in epidemiologic literature, right? So our hypothesis was that part of that gap, the problem in that gap is that it involves people doing something. And doing is very difficult. Making people do things is very difficult. And making people adopt new behaviors is very difficult, and it takes time. But it is an essential part of successful health risk communication strategy. The research objectives for the Smoke Sense was to learn personal motivations in adopting health protective behaviors in the context of wildfire smoke exposure. And that would then help us kind of inform how to better communicate health risks during wildfire episodes. Smoke Sense is mainly facilitated through the app, use of app. Citizen scientists can download the app it's free, available to everyone. And what the app does is brings the health and smoke resources when and where we are affected by smoke, and explores why and how these gaps in our behavior is occurring. One of the nice things about taking the citizen science approach and the app approach is that this kind of knowledge is very difficult to acquire in any other kind of way other than through surveying. And even with surveys, it's very difficult to survey people when they're being exposed by smoke. And so I should pause here to say that this is not we're not looking at the emergency response type of motivations. What Smoke Sense does is promotes issue engagement and education on the topic. And we hope to through engagement, make this personal connection between changes in your environment and changes in your health. The same way that a lot of personal devices do, and a lot of different personal technologies, wearable technologies do, like step counter and so forth. And then through engagement, we raise personal awareness about the salience of changing behavior in the long run. So that's our long range kind of a game. As the Smoke Sense is available on iOS and Android. And as I said, we think it provides us innovative way of acquiring knowledge base that can help us develop better communication skills at the national level. And being a mobile application, we can change from season to season and be asking new questions. So in the app, users can participate, and participation involves you can participate in different ways. One of the ways is by reporting your health and smoke observations. And when you're reporting your health observations, you can also report what you did to reduce your personal exposure, or in response to your exposure to wildfire smoke. The app also provides a lot of resources, as I said. So you can see the maps of smoke plumes. You can see these are just some of the layers that the app has. You can read about different fires for situational awareness. And you can look at the forecast movies over the 24 hours where the smoke is, and just kind of understand how smoke travels at the national scale. The app also incorporates elements, educational elements. One of them is Air Quality 101. That's the last slide over there, where we made small lessons where we took a wildfire public health guide for wildfire guide for public health officials, which is one of the EPA products, together with partners. And we rephrased the paragraphs in something that would be more kind of inviting and learning and easy to absorb, right? And it's a little bitty, it's a tiny quiz. There's also another game that's called Smoke Smarts. There's Air Quality 101 kind of a training module. And users, participants earn badges for their participation. So what I want to talk to you about, we launched this app in 2017. It was the Android app came out in August, and iOS, we weren't able to get it out until October, when we thought that we completely missed the whole fire season. But then Sonoma County fires occurred. And during this brief period of time between August and January, over 5,000 people participated and actually downloaded the app. And 1/3 of the participants, or 1/3 of the users actually participated. A nice thing also is, even though some people didn't participate by reporting, the return rate to the app was 92%. So 92% of the users actually continued coming to the app and exploring the data and educational modules. Overall, during this period, the sample size was, they were younger population, more educated, more white, than with a larger portion of female as well. And very much representative of app users and the population that was affected during that fire season, but not overall. So for the next couple of slides, I just kind of wanted to show you what we have learned through these participation reports. Vast majority of participants could clearly recognize smoke as a hazard. So when we matched their reports of smoke to NOAA satellite images, in over 80% of the time, they reported in accordance to NOAA satellite data. Another thing that was immediately obvious is there is an incredible need for this kind of data. And there's incredible need for information about air quality during these episodes, the type of information that we currently don't have. And since then, this was in 2017, a lot of new sensor data are coming on the market. And you can see by intake of those sensors on the market that there's a clear need in population for more information about instantaneous air quality during these episodes. So as participants also fill out a small kind of a profile, which they also, point like what kind of a pre-existing health history concerns they have, right? So we call them personal health factors. Based on the responses, we can tell that participation was motivated by the personal concern for health. People with pre-existing conditions were more likely to report, engage by reporting, and they stayed engaged longer in the study. Reporting, the act of reporting was also motivated by personal health factors. Those with pre-existing conditions reported more often and they experienced more symptoms. However, the symptoms that they were reporting were not necessarily related to the health conditions that they reported in their profile. So I just kind of want to point that out because I'm going to come back to it. The symptoms that they were reporting were not directly related to their pre-existing conditions. And also participants didn't consistently evaluate personal risk while 91% of the individuals recognized pollution to affect other people, only 72% of the population of participants recognized air pollution as risk to their own health. Okay. With respect to exposure, so the purpose of this pilot season is to learn a little bit more about how people are engaging in exposure reduction behaviors. 89% took some way of reducing their exposure, and some exposure reduction behaviors were easier than the others, reflecting social, physical, and financial barriers, supposedly. And this burden, so there was also the burdens between different behaviors seem to have diminished by the number of symptoms they were experiencing. So the more symptoms, the more likely they were to take any of the exposure reduction behaviors. Pre-existing health pre-existing history or health factors did not modify the likelihood of exposure reduction, of adopting new behavior. Okay, so even though the participation was driven by concern for personal health, the fact of having pre-existing conditions did not modify personal likelihood of adopting the new behavior. When we take into consideration the mitigating behaviors, such as going to the doctor or taking prescription, then we do see that we modify our behavior when our symptoms are getting bad enough that we need to go to the doctor or use medication. And again, the worse the symptoms, judged by need to take medication and go to the doctor, the burden between the barriers also seem to be reduced. So the two observations that we take from these findings is one, and in considering what kind of communication strategies could nudge people more toward health protective behavior, is that we should be talking, we should consider talking about what people are actually experiencing rather than what their vulnerability status is, because a lot of people are not identifying their own vulnerabilities, and even if they are, that is not modifying their action. And then also, the message should provide compelling evidence that behavioral change is beneficial, because in the absence of clear statement, we kind of tend to do our status quo and do nothing. So I'm getting a message that I'm almost out of time, so I'm hurrying up. I'm sorry about that. Overall, there's, so we're taking these observations. These are two key points that we're taking into the next season, and we're exploring as a hypothesis in this fire season. Currently, SmokeSense has over 25,000 users with over 200,000 sessions launched. There's been a number of newspaper reports. One week it was featured in the Apple Store as one of the top 10 downloads on the iTunes. It just tells you about the need for this kind of products and information. And we are always exploring new partnerships, and there's been a lot of states who have reached out. We have made a lot of accommodations to help states make their own, not citizen science projects, but communication strategies that utilize parts of SmokeSense in parts or in entirety. We also developed a K-12 curriculum, which hasn't been completed because the postdoc that was working on it left, but we're going to continue working on it. And currently, we are beta testing the app in Spanish. We translated it. It should be available in Spanish next week. And then finally, we also conducted interviews of state-level organizations who play a role in responding to smoke, about their perceptions on engaging in citizen science as a way of learning what their constituents are experiencing. And one of the take-home messages from those interviews was that way of sharing the data and visualization in real time. So we have created this portal where everyone can where we created a set of graphics that people can look at what are people experiencing in current time or retrospectively in each state, and kind of how many users there are and what people are doing and how do they feel about their actions. So you can export graphics as well as data. And then finally, before I conclude, I just also want to add that this is only just one of the studies and one of the efforts that EPA has in addressing smoke. And if you're looking for some more resources, you can Google Smoke Ready Toolbox, and you will come to the EPA website. And with that, I'm just going to conclude now. If you don't have Smoke Sense on your phones, you can point your camera to that QR code and download it today, now.